Hey everybody. So today I want to kind of look at some of our liver and gallbladder structures when we're doing an ultrasound. So a big thing to kind of think about first is making sure we image everything that we need to see. So we've mentioned some of the things before that we can change our depth, we can change our frequency, making sure we're seeing the entire organ, making sure we're not missing any little areas because it really stinks when you do a full scan and you miss some bad nodules somewhere or a mass all the way in the back of the liver somewhere. So what I like to do, I start with a subxiphoid kind of approach. So I'm going to get my probe kind of right along midline of the abdomen. So right now I'm actually right underneath the xiphoid, going from the abdomen and pointing my probe in the cranial direction. So if you look on the screen, the M is going to be cranial on the left and right is going to be caudal. And right now I start in a sagittal plane. Sagittal plane meaning the plane of the patient itself. So kind of the long axis of the dog. I'm going to have my probe in that orientation. And once I'm there and I start at midline, I'm going to making sure I go all the way laterally and come back and go all the way medially too. So if you've noticed, what I'm looking at right now is you've got all liver here. So this is all liver tissue. This white line is going to be the interface in between the liver and the air within the thoracic cavity or your lungs. So we're getting that very hyperechoic line. It's going to be the area of the diaphragm. We don't actually image the diaphragm right there, but that's going to be that interface. So we can just call it the diaphragm for now. That's going to just separating our abdomen for our thoracic cavity. When you're looking at this, I've got him in right lateral incumbency. I like to do everything in lateral for kind of a couple reasons, especially kidneys. I can see it a little bit better, but I like being able to use the changes in gas from one side to the next and using gravity from one side to the next too throughout my entire scan. So that can kind of help me figure out what's going on. So even right now, if I'm going to the midline, I start going more towards the right, I get the gallbladder into the image. So gallbladder is going to be this anechoic round structure. His is looking pretty good. Gallbladder wall diameter should be 2 millimeters or less. It's going to be a very thin hyperechoic kind of ring around here. It's not thickened or anything. There's no edema within the wall. It looks good. There's no debris within the gallbladder lumen. Also looks good on there. If there was some echogenic material in there, what's really nice about doing a right lateral and then a left lateral recumbency on these patients is I can see, does that sediment actually move after I flip him from one side to the next? If I see a bunch of material and it looks like it's kind of sticking to the walls and it doesn't go to that gravity dependent area, well, then I might be worried about like a mucinous process or like a mucocele that's starting to form. But if I can see stuff in there and then it settles out on that gravity dependent side when I flip them, then I'm less concerned, which is really nice. All right, so we're going to have the gallbladder just right of midline when I'm doing that subxiphoid approach. Come back up towards the left side and get the left side of the liver, and we actually start getting spleen into the image here, and you can actually see all the gas within the lumen of the stomach sitting along here as well. So you're already seeing the wall thickness and stuff within the stomach. All gas in there. He's pretty empty. He hasn't eaten today. I tried to keep him fasted this morning. So we got spleen. And right now when you're looking at the two, you can kind of tell the difference between these two organs, and especially as they're sitting right next to each other. I'm going to adjust my focal point a little bit to kind of right here on that interface between the spleen and the liver. So if you see the spleen in the near field, sitting right here. It's got a little bit of a hyperechoic capsule around the outside of it, but you can see the spleen is a little hyperechoic compared to the liver, so a little brighter on there. And also when you look at the texture of things. So we're saying texture, I kind of think of like the coarseness or how smooth does it look, or compare it to a sandpaper, a really fine sandpaper versus a coarse sandpaper. If I wanted to, can't actually feel it, but if I was going to kind of pet my little spleen right there, that actually looks like it would be a nice smooth surface as I'm running along it. Compared to the liver, I feel like if I start rubbing my hand along there, it's going to be a little rougher. So we kind of have a kind of smooth extra texture, and it's a little bit more rough extra echo texture within the liver. Within the liver, you'll say, well, what can I actually see in here? You see these kind of tubular structures. There's a nice one right there in the middle that has a hyperechoic wall. Your portal vessels are actually going to be the ones that have these nice hyperechoic lines on there. So I can see all these portal markings is kind of the That kind of making that rough echotexture look, because you see these hyperechoic portal markings and portal vessel walls versus the smooth parenchyma around it kind of gives it that rougher appearance. Hepatic arteries we don't typically see. Hepatic vessels, sometimes we can see them are portal vessels in there. I don't see many veins going through here. When we come from the other side and actually image the right side of him in the area of the porta hepatis, be a better area to see that portal vein coming into the liver, seeing the aorta and seeing the caudal vena cava. But right now I can really see nice portal markings in here. There's a nice portal vessel wall right there. That nice hyperechoic tubular structure is beautiful. Cats, sometimes when you're imaging their gallbladder, some of them might actually be bilobes. So you might see 2 lobes in the liver and that are in the gallbladder, and that's completely normal. So don't worry about that. Also, when you're looking at this side, I'm always kind of comparing it to the liver, comparing it to the spleen right there, making sure I don't see anything. Sometimes it's hard if there is a mass somewhere to tell if it's coming from the liver or the spleen. But sometimes I'll look to see the blood supply going through the two and seeing if they're kind of continuous within a blood supply within the liver. So if I wanted to, I could put color Doppler on things. We can increase the sensitivity a little bit. I can decrease the size of this a little bit. So if there was a mass somewhere, I could actually follow it and see if there's any vessels that are going from the liver into the mass, or if there was something on the spleen, I could see if it's actually continuous with any of the vessels going through my splenic type of parenchyma as well. You can adjust the power of your colored Doppler actually just by playing with your gain. That makes it sensitivity increase or decrease right there. So you can see that. I showed you earlier on the fast scanning techniques that we were working on. If I increase my depth a little bit, this is also a good view if you're looking for pericardial effusion. So there's the heart actually bumping nice and slow heart rate on this guy. So I can actually see some of the chambers of the heart in this view. So if there was pericardial effusion, I could see it. I could also see and monitor for any signs of pleural effusion right there too. So when we're looking at the different lobes of the liver, unfortunately, we don't normally get to differentiate the lobes because they're all adjacent next to each other, and there's not much of a difference in their acoustic impedance or their ability to send back our signals to us. So I don't see the different lobes. Sometimes you can see lobes, though, if there is a bunch of abdominal effusion. If there is, then sometimes we see the fluid going in between the lobes, and then you can actually see it. You should also look at the liver lobe margins. A normal liver should kind of come to these little triangular margins on there, too. If I saw hepatomegaly,